Another intervention that I did was I had a patient, an older woman. She's picking up Lipitor 80, and it flagged that she picked up like some Crestor a little bit ago. So 80 is the max dose for Lipitor, and it was flagging it's a 40 milligram Crestor, which is also the max dose. So I figured out that she was taking both of them, which is just a recipe for disaster. So I told her that she needs to stop one of them and then also call her doctor. See if they need to take like a CPK or see if she's having any like side effects from that. It didn't seem that she was having any really side effects, but I wanted her to follow up with her provider to see if she could get some labs drawn to see, because if you take like too much of a statin, you can get some muscle breakdown, and you can see that in the labs. It can also cause some pain too for patients, and if at worst, it can cause some kidney failure, rhabdomyolysis. But my last intervention, I had a patient who's on hormonal replacement therapy, estradiol. It was 2 milligrams sublingually twice a day. Patient ran out of refills, so I allowed an emergency fill. So for maintenance medications in Indiana, we can allow up to 1 month supply of an emergency fill, where we don't need a prescription for it, basically, if they're out of their prescription or it expires or some sort of issue. But I had that patient follow up with their provider within the next 2 days to get another prescription for that. And then I also updated her pronouns in the profile because it wasn't updated. So those are two things that I did for that patient.